Well, I got to say, these numbers are rising fast. And for the sake of keeping us on track, I'm going to just jump right in there. So good morning, good afternoon, depending on what coast you're on. My name is Carrie Scott. I work at Spruce Health. I will be serving as today's moderator so that we can guide the discussion in a meaningful way and make the best use of everybody's time. So with that, let's get down to it. We are going to go through a couple of introductions so that you know who's on the call with us today. I will have Jessica, our Spruce expert, talk about Spruce Health. For those of you on the call that are new to us, we're going to introduce you to Silverleaf and give you a high level of what you can expect there. And then we're going to get into the essentials, what you need to launch your practice, the technical tools required to deliver a professional presence, the importance of investing in modern tools. We'll get into an ROI discussion along with some case studies, and we're going to leave time for questions as well. We may answer a few intermittently, but we're going to save the bulk of them for the end. So please do drop your questions into the Q&A, load them up as they come to you so you don't forget, because we are eager to answer them. And with that, I'm going to do some intros here. Today, we're meeting Beverly Johnson. She is the founder and acting manager of Silverleaf PMS. Beverly is a registered nurse with more than 25 years of ER nursing, management, quality, and various admin positions. In 2018, she researched and figured out how to open up a friend's practice. She spent hours and hours education and research, and it led to a very successful launch that drew in more than 700 patients with one provider in 9 months. Pretty incredible. She led everything from the business startup to maintaining the overall daily practice management. And she now leads the clinical business consultation, website design, marketing, and EHR building portion of Silverleaf. I don't know how this woman sleeps, but that is pretty incredible. We also have Megan McDonald joining us. Megan is co-owner of Silverleaf and the virtual assistant director. She has been in the customer service industry for 13 years, and she's instrumental in onboarding new practices and helping them to get set up on their technical stack. So between these two, we have a wealth of information that we're going to glean today. We also have Jessica Gula. She is our sales leader and Spruce expert. She's joining to share some insights into Spruce and answer any questions that the audience may have about Spruce. As I mentioned, we're going to save the bulk of those questions for the end, but please do drop them into the Q&A as you think of them. This event will be recorded. I want to remind you of that. It will be shared with everyone that registers. So keep your eyes peeled for an email that will follow up this event. I will also send you the link to the slides and the other resources that we're going to mention throughout the presentation. So don't worry about missing anything. You are going to get all of it. And with that, I'm going to just pass the torch to Jess. Off to you.
Well, hi, everyone. I'm so excited to see so many people attending today. I've worked at Spruce for 7 years. I have worked in every capacity at Spruce, but I mostly focus on helping people learn what Spruce does and get them set up. And so there may be some people on this call that have never heard of Spruce. I hope not, but maybe you haven't heard of it or don't know what we do. But we are a HIPAA compliant software for clinics and healthcare professionals ranging from any specialty. We consolidate all your communications into one system that's going to have an amazing audit trail, as well as be collaborative with your team. We do everything from your in-office business phone to using your cell phone for a virtual business phone to fax, email, texting, both by SMS and by secure messaging. And as you can see from that image, that's a little screenshot of our app. We have a mobile app plus web-based. So we really just want to help healthcare practices be more efficient and secure in their communication. And that's what we've been doing to help you do that. But if you have any questions, we're also going to have our contact info at the end. And one of the reasons, we partnered with Silverleaf and have them on the webinar today is because they also work with healthcare practices and provide so much great education to them that I work with so many of their clinics that then end up using Spruce. So that's why we wanted to bring them on. We're really aligned in making sure that healthcare practices are efficient for both patients and the providers. So that's it for me for now.
Thanks. Hey, Jessica. So thanks for that great introduction for us, you guys. That's very nice. We have been helping providers launch their private practices for a little over 4 years now. And we offer a wide range of services. Carrie touched on a few of them, but we also offer billing, credentialing, virtual assistant services. We do help set up Spruce for some of our clients. We do EHR setup, HR services, marketing, website, logos, you name it, we probably do it. Pretty much anything you need to start up the practice or maintain your practice after you get it up and going. So when we also offer, consultations to those that may need questions answered when they are getting ready to start up their practice, or even for those folks that are in their practice and are still kind of like, oh, I'm not sure, what to do here. Maybe I need some help. We can help you with pretty much anything you need troubleshooting with. We've tried many products and platforms to find out what works most effectively and efficiently for practices across many different fields of specialties and even sizes, from the one provider up to, I think the biggest provider was close to 20 providers in their office. So various different sizes, but that's how we stumbled upon Spruce. We've been recommending Spruce to our clients ever since. So the next thing we're going to talk about is the essentials needed to launch your practice. And this is where I kind of come in a lot to help folks kind of get started. We do the consultations and everything. But the things to be thinking about just from the very start, you want to get yourself off on the right foot, so to speak. So here's a few pointers. And by no means is this everything. These are just some things to get started with and to think about. The first thing, think futuristically. Like what is your plan your practice going to look like in a year from now, 5 years from now, 10 years from now? What is that goal? Where are you trying to get? And you want to plan accordingly. So just because it's you today, but in 10 years, you might want, partners or whatever, plan for that now. Have a solid business plan and use that as your roadmap to guide you. And there's plenty of help online for business plans, because I know people kind of get, stumble around with trying to figure out their own business plan, but there's lots of information online to help you with that. Decide if you're going to be a solo practice, a partnership, or eventually a multi-provider group. Talked a little bit about that. Talk to a CPA. A lot of people don't know, they get confused on the business structure versus the tax structure. And that's going to vary depending on your future plans. So make sure you talk to that CPA, get that lined out, get your tax structure started from the very beginning. Figuring out a name, research it, make a firm decision and go with it. You don't want to change it later, because that's going to cause a lot of issues for you and processes. We've had providers do it. They start with one name, they get halfway through all their setups and stuff and decide either they found out somebody else has a name similar or they don't want to use that name and they change it midway. That's a disaster. I mean, credentialing applications get messed up, have to go back in and change everything in Spruce, in EHRs and things. So pick that name, stick with it. The next thing is establishing your business with the Secretary of State. Most states, it's just the Secretary of State, but there are some states out there that require you to also go through the Board of Nursing, or your medical board if it's a medical practice and not a nurse practitioner practice. So make sure that you're checking the rules for your state. And then a lot of providers get hung up on the address part. And this has kind of been tricky, especially with the PHE, the public health emergency ending. People have been able to start up telehealth practices during COVID, and those have been fine. But now that the public health emergency is ending, there's a lot of things to consider with that. And I'm not going to go into that in a lot of detail here because it's just not the place for it. But a strictly virtual address is not going to work unless, especially if you're prescribing controlled substances or if you're going to get credentialed with insurances. So just be mindful of that. A PO box isn't going to work. A UPS box is not going to work. So, and you definitely don't want to use your home address. Using your home address, I've seen people do it. Lots of people do it. And that, guys, once you get your home address out there on the internet with your business name, it's hard to pull that back. And you think about, a lot of providers that we deal with are psychiatry providers. You don't want patients knowing where you live. It's just not safe. Some people have boundary issues. You just don't want to do that. So definitely don't do it. We talked a little bit about the PHE ending on May the 11th. And I think there's been some recent stuff on that. I just don't have the up-to-date. Biden signed something, I think yesterday, and I need to do some more research on that. But prior to that, they were saying the PHE is ending May the 11th. So with that ending, the Ryan Haidt Act will come back. Prescribing controlled substances are going to be subject to that, meaning that you have to see patients in person before you prescribe controlled substances. And then your state can actually tighten that down where they have more rules as well. Get your tax ID or tax ID, employee ID, you'll hear them called a TIN or an EIN from the IRS. Super easy to do that. It's an online application once you get your business established. Or if you go through a company that will help you do the basic business setup. We don't do that part because it's kind of legal stuff, but they will actually help you get your TIN or your EIN from the IRS as well. And then kind of think about this. Every state is like their own country. They have their own laws. They have their own business requirements for that state. They have their registered agent requirements, permits, controlled substance policies, like I mentioned earlier. So it's not as easy as just jumping from one state to another to start your private practice. It's not just like, just have a license, I can go over here and practice. It's not that easy, guys. So if you're wanting to do multiple states and practice in multiple states, make sure that you have a business attorney that's involved and that you are staying, compliant with all the different state laws. And those change too if you decide to hire employees in different states. There's a lot to doing that. And then just decide if you're going to be cash-based or if you're going to take insurances. Credentialing alone for a new private practice can, but doesn't always, take up to 6 months. When you join another practice, it's already established, it's quick because their business is already credentialed. When your new private practice comes into play, it's credentialing your private practice along with you. So that's why it does take longer. It doesn't always take 6 months, but just be prepared for that, that time frame when you're getting ready to start up. So like I said in the beginning, this is a few things to consider. We could literally take up the whole hour with just talking about, all the digging really deep into all the details on starting up. So we do offer consultations if you need further one-on-one assistance and need more questions answered. And then the next thing we want to talk about is a checklist, or actually, yeah. So checklist, a checklist is going to help you stay on track. And we actually are offering you guys one of those, and that's one of the links down below. All the participants in this webinar are going to get discounts on our checklist, classes, previous webinars that we've offered. These links will be available to you as well in the email that you get, and on these slides you can click on. You don't need a special code or anything like that. The discount's already been applied when you click on the link. There is a YouTube video there that tells you about all the services that we offer, kind of a pre-consult, I guess you could say, to all of our services. And you can, get all the information that you need there on everything that we offer. And then, so you're going to get an email with all of these after the webinar. So make sure you watch your junk mail. It may end up landing in there, so that you make sure that you get all this. And that's a lot of information just in these links that we're providing for you. So the next thing we're going to talk about is, things to consider when you're establishing your professional presence. So there's a few things you need to think about. One is what is your online presence going to look like? Are you going to have a website? Having a website is very important nowadays because it really adds validity to your practice and you. I mean, it's the first thing you do, right? When you're looking up a business, what's their website look like? It's also a place for you to drive traffic to when you're marketing your private practice, or when you put your name and everything on a business card and you're handing those things out. It's very important. And then on your website, you should have the availability for online scheduling and for clients to be able to do that with you. And that leads me to my next point. Your EHR should have online scheduling. There are a lot out there that make you go through portals and all these things. And, unfortunately, I don't guess it's unfortunate, but we do live in an instant gratification society, right? I don't know about you guys, but I don't even go book a hair appointment if I can't do it online at 2 o'clock in the morning. So it's very important that people can just find you, book an appointment. If you're not doing that, guys, you're playing phone tag, going back and forth, trying to get a hold of patients once they've called you at the end of the day, you're missing out on clients. Because if they've called you, they've called 10 other providers. And chances are, if you're doing this part-time and you're calling them back at 4 o'clock in the evening, they found somebody else. So just make sure that you are going to offer online scheduling for your patients. And it should be online scheduling to the point that it goes directly into your EHR, not where you're having to take the schedule and put it somewhere else, but that's a whole nother conversation. Social media. So there's a lot of people that have mixed feelings about this. Some people like social media and are very engaged in it, and other people don't engage at all. However, social media is, not going to go anywhere. It's actually getting more and more prominent, and you or someone that you hire or whatever should be marketing your practice on multiple social media platforms. And those, we know what they all are: TikTok, Facebook, all of that. It's very important that you establish that social media presence out there. And then marketing comes in all shapes and sizes. So some marketing you can do yourself. It's pretty easy. We can definitely help you with that. And then other types may be left to the professionals, building graphics and stuff to post out there, helping you with videos. So it just depends on, what help that you're going to need. All of us have different technical skills. Some are more comfortable with building graphics and doing videos, and others not so much. So know when to get help. Marketing is huge, guys. It's going to be your biggest thing that you're going to budget for in your first year, trying to get those patients in the door. It's never a one and done thing, ever. You have to keep marketing, and you have to figure out what's working, what's not working, where you're getting most results, and shift your focus. So it's just really ongoing until you get that steady stream of patients. We're like, hey, slow down, got plenty coming in. Until you get to that point, you are going to be continuously marketing. And then choosing your EHR. This is a topic that our Facebook group constantly gets asked about. Let me just preface saying that there is no perfect EHR. They all have issues. You just have to figure out which ones you're willing to deal with and which ones you're not. But remember one thing, that the reps that do those demos for you to sell you those different EHRs are there to sell you a product, and they will promise you all the rainbows and unicorns. And then, they'll tell you why that their, EHR is the best one out there. Believe nothing that they say. Because it's not that they lie to you, they just don't tell you things by omission. And if you don't know the questions to ask, once you sign that contract, you are theirs, and they are not going to let you out of it unless you pay them a lot of money, and you're going to have regrets. So listen to your colleagues, listen to people that have done it before. Go to the different groups on Facebook, do your research, ask us. I mean, I post things all the time in our Facebook groups about different EHRs and, problems that we've seen with others. Megan can also tell you the problems that she's seen from the front office. Our billing department can tell you. That's just the way EHRs are. Make sure they do promise you anything, that you get it in writing, because if you don't and it's just words, it's not going to stand up, and they're not going to deliver that. And I have an entire video dedicated to that whole topic of picking your EHR. The other thing to think about is employees versus contractors. So at some point you're going to need help. We're all, especially women, I'm not kind of trying to slight the men out there or anything, but women like to wear the superhero capes, right? We want to do everything. We can do everything. We can do the house, take care of the kids, work a full-time job, open up my private practice, and do all the things. What happens is, if you've never run your private practice, you don't understand how much work your ancillary staff does for you. Answering the phones, scheduling patients, taking care of all of those little things that you just don't think about when you're taking care of patients. So you'll need to make the decision whether or not you're going to hire employees or utilize a contractor to help you. Be mindful that the IRS has very strict guidelines on how to treat both of these types of workers. Just because you don't want to hire people and pay taxes or, provide benefits on an employee doesn't mean that you can just hire a contractor. Misclassifying a contractor and treating them like an employee can cost you lots of money. So just make sure that you know the difference between the two, and you can Google it on the IRS website. It's very clear: employees versus contractors. And then the last point here is making sure that you utilize the right systems and tools to make your practice successful. Finding something that's free, not always the best idea, but neither is going with the most expensive thing, right? So remember that your time is money, and automating processes all across the board saves you both time and money. So selecting the most expensive EHR doesn't mean that you get the best one, right? It just means you chose an expensive EHR, and it doesn't really mean that it's necessary. So the same point is true for any systems and tools. We hear providers tell us all the time, well, this phone system is free. Well, that's great, but that phone system only comes with a voicemail. So which means that you're going to be spending time calling patients back, playing phone tag, getting caught on the phone with potential patients, that you can't get off. I don't know about y'all, but I can't even get my family members off the phone in 15 minutes. So calling people back, you end up spending 35 minutes, an hour with them on the phone, and that could have been a visit, or you could have charged them for that. So remember, your time is money. If you don't take anything else away from this whole webinar, think about that in every step that you make through your whole practice when it comes to hiring folks or picking the perfect platforms or whatever. Your time is money. So investing in a system like Spruce and utilizing it to its full potential, because it's not always evident when you first log in, like all the potential that Spruce has. And we're going to show you some of that stuff toward the end, but it has, guys, it has so much automation in there that can save you so much time and so much money doing these things. And that frees you up to do things like enjoying time with your family and just taking time off, because if you do try to you'll get overwhelmed and get burned out really easy. So automating is very, very important. And Spruce can definitely help you with that. all you have to do is see an extra patient once a month, pays for it, you're done. So that is my part, I think, of this. And we're going to go into the next part.
That was so much helpful information, Beverly. And
It's
it's a lot of information. You're able to like give some good tips and stuff. And per usual, people can always sign up and go to your website to learn more and sign up for sessions and your consultative skills. And also, I also just want to say, you know, Silverleaf and Spruce, you know, we're just two businesses that happen to work with the same clients, and we both just respect and see them doing great things together. You know, so neither are paid by each other or anything. Like, we're unrelated. We both find that, you know, Beverly's team, they're trying to get providers to be more efficient, you know, and we help do that. So they love recommending Spruce. That's it. But just wanted to say, and also Beverly's going to tell you the real of Spruce, what we can and we can't do. We're not, you know, magicians. There are some things we can't do. So she's also her team is a great resource if you do have questions, because it is hard sometimes to know what the right questions to ask about a phone system or an EHR, like you said. And I see the same thing, and I'm happy to tell you what EHRs work with Spruce, how you can use any EHR with Spruce as well.
Sorry, go ahead, Jess.
I was just gonna say, I see some questions coming up, and we're definitely going to address them, but I'm going to leave them towards the end because I think everyone will like hearing them together, and we can just kind of address them at the end. So thanks for putting those in and continue.
And I think you'll agree, Jessica, we've gone through many providers and many different setups and have tried all kinds of cool things. Some things worked okay, some things didn't. We kind of, would go back and, circle back and fix things. But over the last we've been working with you guys for almost 2 years, or probably a little over 2 years.
Oh yeah, longer than that.
Yeah, a lot. So, I mean, we've set up numerous practices over the years, and we're well-versed in all the problems that can occur, not only while setting up the practice, but also running it day to day. That's Megan's ball game all day long, like trying to streamline processes with providers and fix, help them from the beginning, or stepping in and trying to fix them. So I'm going to hand this over to Megan at this point, because she's the one that manages the Spruce setups and our virtual assistant services and everything. And she also serves as practice manager, kind of the practice manager liaison to some of our clients as well.
Thank you, Beverly. Hello, everyone. Delving just a little deeper into systems and tools. If you're already in practice, you are likely dealing with some of the issues we've listed out and talked about previously. The trick to streamlining your new practice or current practice is doing what you can to reduce the number of platforms you're using to get your day-to-day job done. It's enticing, like Beverly said, to go with something free or relatively inexpensive in the beginning, as you may be concerned with overhead, but making sure you have the right tech stack is critical for both organization and growth. We have found that utilizing Spruce in all sizes of private practices, and especially solo provider practices, decreases the front office administrative time significantly, whether those things are being done by you, the provider, in between your appointments or afterwards, or by someone on staff. But organizing and streamlining your processes, you have more time, like Beverly mentioned, to see patients, do personal things, and that also allows the front office staff to be able to handle additional tasks outside of those. We've been able to eliminate the use of multiple platforms and softwares in practices and streamline those processes to save you money. As someone who's provided support to numerous private practices over the last few years, I've witnessed firsthand the stress that really does accumulate with simply dealing with phone calls and text messages from patients. That volume can become very high. We've all played phone tag with clients, sent the same message over and over again about everyday things like overdue paperwork or needing to relay the onboarding process to someone. We all know that when we're on the phone with a new patient, telling them everything that we need, they may not, especially depending on what they're looking for help with, may not be able to gather everything that you're saying to them verbally. They may need you to follow up with some kind of text message. Let's see, having to return voicemails that just state a name and a number. Hey, can you call me back? My name is so-and-so. There's no indication of what that person might need. I found that with Spruce, you can rely heavily on the system itself to support you. It's important to invest in these modern tools such as Spruce to enable you to streamline processes and workflow, as well as increase productivity by utilizing automations and decreasing manual processes, meaning you're having your phone system do some of the work for you. These are some examples on the solution slide of how we've applied Spruce in accomplishing some of these everyday administrative needs. Think of Spruce like your communications hub, like Jessica mentioned earlier. It's one platform. You're sending and receiving emails through there, calls and faxes. You're able to talk with your patients both via text regularly, SMS, if that's easier for some. Spruce does have an opt-out feature on their platform. If someone chooses to just regularly text, that they have to put permission in there, basically they understand it's not compliant, but you're also able to talk with them securely. It's very easy for them to join Spruce on their end. It takes, I would say, about 20 seconds for them to download the app and enter in their patient information.
Yeah, I just want to pause for a second. So like, you guys talk to practices getting started or established and wanting to expand every day, as do I. They come to Spruce either with an existing phone system they want to upgrade, or a brand new practice. And, so the slide before, Kara, is, these are the common problems we're seeing, and these problems that you have need to be solved in order to be a successful business, and Beverly touched on this. Like, if you're paying yourself to do some of these things where you could be seeing patients and charging insurance, that's a fault. And so this is a list of the very common things we see that either, making sure you've researched like what you're doing, looking at where you're spending your hours, are you capturing potential patients? Are you HIPAA compliant? Like, these are some of the problems that we see. So make sure you're addressing these problems. And then the next slide is what, our team and their team have come up with to help solve these. And they not all need to be, human solutions. Some of these, like Megan, you talked about, are these kind of automations you build in the right technology that you use, whether Beverly mentioned the EHR that can do online scheduling, or like Spruce, you can have press 1, press 2 for billing, and then it automatically goes to a billing folder so that you don't have to worry about it, that your billing team can look at that, and then you're not getting disturbed by that. So just wanted to kind of give some more context there. And, some of these things you've set up, what are some of the other ones on this solutions list that you think that your providers respond well to?
So I actually do circle back to that here in just a second, Jess, about, the different phone trees that the different selections that you can put in a phone tree, and what those corresponding recordings could do for you, so that your system is helping you provide information to patients, categorically that they're looking for, and can help them be most self-sufficient on their end, and therefore reduce some of the work that you have to do yourself. So I will mention some of that here in just a second. I do want to also mention that Spruce does offer, it facilitates inter-office communication with your staff members within individual patient threads. So if you have a patient message in, hey, I have a med concern, there are a lot of systems where it's just a text message from the patient, and now the front office admin needs to go into another system and relay that message. Whereas in Spruce, as soon as that message comes over from your patient, you're able to directly underneath it tag your provider, let them know what's going on, and the provider has the opportunity to either internally message you back, the staff member back, and let them know how to proceed, or they can just externally message the client and let them know what to do on their end. So it really is just such a clever system. And like Jess was saying, many things can be set up to automatically happen in the background. So she was mentioning the phone tree with the selections. You could set up a phone tree with selections such as appointments or insurance and billing. These lines, upon selection by the patient, could provide that additional information to your client, making them a bit more self-sufficient and reducing the need for a call back. So your billing line, for example, could specify what insurances you take, or maybe even state that you don't take insurance and you'll provide super bills for reimbursement purposes. You could put in a med refill selection on your tree that could tell patients what all they need to do on their end before leaving that message with the request for you. So for example, calling their pharmacy to ensure they don't already have refills on hold, or prompting them to book an appointment first if they haven't been seen within a specific amount of time, like 3 months. You you can imagine just how detailed you can get when setting up the phone tree and just how much it can help relay that helpful information that we were talking about to both your established and potential clients. Let's say you have a multi-provider practice and would like to easily distinguish your patients from that of your colleagues. You could even turn to the tagging feature of Spruce, and you can set up a filter. It kind of looks like a folder that'll organize those patients the second they message in. The system's able to recognize the tag, and I believe we even have a photo of this in a few slides to kind of demonstrate what that looks like for you inside the inbox. But that would make it easy for your providers to go in and see, oh, hey, there's 12 things in my filter. Let me go see what's going on with those. Often we see office changes needing to be updated, to the client, some kind of policy change that you need to communicate with everyone. Spruce offers bulk messaging. It's a really clever feature. It sends a bulk message to everyone. It's one time for you, but those people do not know that there are other people in the group. It just comes over to them solo. Maybe you're a practice with admin staff that handle different areas of the practice. You can set up what Spruce calls teams. This allows you to assign certain people to certain types of calls that come through. Do you have an outside billing company? We can help you set up forwarding of that specific billing selection on the phone tree to automatically ring an outside number, allowing your billing company to intercept the call and handle the billing issue as it comes through. With all of this said, we're still, like Beverly's mentioned before, when she was talking about setting up your private practice, what we're mentioning in this meeting today is purely just scratching the surface of the full capabilities of these platforms, especially Spruce, and what it can do to help you grow. Circling back to organizing and streamlining things, you have more time to do other things, and your staff now has the availability to handle more higher level tasks, like filling out legal documentation for you based off of your chart notes. The less that they need to do patient communication wise frees them up to do more tasks like prior authorizations and handling medical record requests, all of those kind of things. And that kind of circles us to establishing a viable ROI model. And I believe Beverly will pick back up right here. Beverly, you're muted.
It wouldn't be a webinar if someone didn't talk while I'm muted. I mean,
exactly.
Or a Zoom call.
The dogs barking in the background, kids running around. So in combining the right resources and the right tech stack, you can definitely get your practice on the right track by being successful from the very beginning. Because when you're setting up your practice, you really want to set that foundation up in the beginning, right? To be stable and everything's going smoothly versus scrambling, trying to, oh my gosh, I got so busy so quickly and I didn't have the right stuff together. And, I'm floundering and, I don't feel real stable in my practice and things are just crazy. And, I'm working 20 hours a day type thing. You want to make sure that everything is established on a good foundation. So, when you have the right resources, we can help you with that. We span all the different resources from the website design to marketing, even the virtual assistant services, and we can help get your practice launched in a record time. But we can also assist any current practice, to get them back on track. So like Megan said, reducing administrative tasks right out of the gate, from calling patients back to refilling prescriptions, minimizing the number of disparate systems, in place and optimize kind of into one holistic solution. I mean, we say one, we're talking about one communication solution, that's outside the EHR and all that kind of stuff, but Spruce definitely brings all of that communication into one place. So creating a set of processes too that are easy to set up and very streamlined for the whole team to use is also very important. Doing these things, I think we talked about how this can all help, with your ROI and everything and helping you save money and save time. So with that, I'm going to give that back to Megan so that she can go over what she wants to tell you on this slide, and then we will move forward.
We've mentioned it before, you guys. We're just, bringing it home to you again. We help you guys set up these phone trees, autoresponders, all of those kind of things that are based off a schedule. So you can switch between, a current hours phone tree and after hours phone tree. The templates that we've used have been brought to Spruce. They've been approved. The engineers, have it down pat. We've really gotten it streamlined with building these projects for you. So like we mentioned before, streamlining your practices reduces your admin overhead, and Spruce does all these other things like facilitating that smooth inter-office communication we were talking about within an individual patient thread or organized into broader topics, and all of this while being HIPAA compliant. I can't tell you the change I see in practices. That is a kind of my specialty, or practices come to me because they feel just a little disjointed. Things don't feel exactly clean, and it significantly decreases the amount of time they have to pay front office staff once we get them into Spruce. And I just had a text message earlier today from a provider who I am setting up a Spruce account with now, and she just got in today and started using it and texted me that it's blowing her mind. She said she cannot believe how helpful it's been, and she's only been in there since early this morning. So it really does change the game for you guys. Some situational stuff. So let's get into some case studies of clients we've had in the past, some of the issues they were having, as well as kind of how we've resolved those for them. So getting into this one here, this particular provider was having difficulty collecting payments from their patients. So they had a lot of outstanding invoices, $27K, that's quite a bit of money. And previous attempts at sending those invoices through their EHR, multiple phone calls, text messages, that had all proved pretty unsuccessful. What we started doing was PDFing the statement, attaching it with what you can create. You can create these kind of canned messages inside of Spruce, so you're not having to type the same message over and over again. We pair that with that kind of secured, the canned message and a payment request. That allowed them to make that payment on their phone through the app. It was really easy for them, and we saw a huge turnaround in getting that money. It happened almost immediately. It was previously seen as lost revenue, and any collection of that is, that's great. I think that was so awesome. The provider was super happy about that. Of course, who wouldn't be happy about, an additional 27 grand in your pocket? And on this slide here, it shows you what that looks like inside of the system. So you can only take payments through the secure platform, which I think is great. I think that's a really good way to keep HIPAA compliant. And you can take those payments. You can see the icon down there with a little arrow. You're able to integrate your Stripe and your Square account with Spruce. So you're able to request current and or past due balances, forms fees, any kind of fee that you need someone to pay. It's pretty easy to request through there. Do this though, be mindful that if you do start accepting payments through Spruce, through that platform, that you also need to go and properly allocate that in your EHR system. Those things do not match up. So you have to take the payment from Spruce and go allocate it properly to the appointment in your EHR, and then make sure that you're deleting or canceling an invoice that may have originated automatically inside of your other system, because EHR systems do sometimes automatically create those invoices. The next one, this was kind of circling back to that multi-provider practice that I was talking about earlier. The front office staff was having difficulty keeping providers and patients separated. So it was this particular practice was a 9-provider practice with about 7 admin assistants. So you can imagine the inbox was pretty wild. Excuse me. What the staff was having to do was go into the EHR system, search for the patient, and some of these EHR systems don't make it easy for you to search. You may have to actually change the provider in the system, and then you can search for their specific client. So you can imagine this was taking quite a while for them to try to figure out whose provider that was, or whose provider they needed to contact. So by utilizing tags, you can do a couple of different kind of tags in Spruce, but in this particular situation, the best tag to use would be a contact tag. That allows you to add a contact tag to that person that is, it could just be the last name of the provider. And then you can set up an inbox filter to actually filter those out. So you can see here on this page how you see the folders for Dr. Gulish and Dr. Sanchez towards the bottom there. Those appear to be folders. These are actually those inbox filters that I was talking about, and And those are set up to specifically read those tags placed on the patient's contact. It will automatically filter that call or text into that provider specific filter or folder, however you want to look at it. Now, Dr. Gulish, for example, or Dr. Sanchez could log in and see what patients of theirs messaged in and determine how to help. This particular setup would be beneficial for a practice that might not even have an administrative assistant or has such high volume that the provider is directly involved in their own patient communications.
I just wanted to pop in just with some more product knowledge here. Overall, what Spruce tries to help you do as a practice is customize it based on what you need. So if you need to divide it by provider, if you need to divide it by kind of inquiry type, it can be done. This is one example of a tag. You could tag. So if you have, you want to identify which provider they're seeing, but you still want to go into the main inbox where an admin checks all provider messages, you can do that. If you want it to only go to that exact provider, you can also do that. So know that we've built a product because every healthcare practice is very specific, has their own needs. And so to be successful, we really made sure to make it customizable to you. And, someone just asked a question about hey, everything's going to my all inbox, which is kind of like the default, and so it is important to speak out. And once you set up your Spruce, to be like, hey, I'm having these issues. What do you suggest? And we're gonna be like, okay, so it sounds like you're doing this. Why don't we set up tags? Or why don't we set up your phone tree or different things? And again, don't forget about that opportunity time that you're spending manually moving these things so that you can upgrade to the communicator and have it automate before you even see it. So then you can spend more time with your patients and less time doing these admin tasks. So just had to do a quick shout out there, but best way is to email sales@sprucehealth.com if you're not a customer and you have a question, or if you're a current customer using Spruce and want to do any of this, just message into Team Spruce. And our team is so used to the different workflows that healthcare clinics have. I'm sure we can help you. Or if you need extensive support, you can, look at their website and see what services Silverleaf offers.
Yeah, I always tell.
Sorry, Megan, that solo one inbox with no filters can make you crazy. Once you're busy, your practice gets busy, everything's coming in there. If you can filter and create those little folders, I call them folders because to me that makes more sense, to organize that stuff, it will make your life so much easier.
Well, I do circle on to that too for our last case study, which is the case of the onboarding disaster. So, Spruce really is such a clever system. And I tell people sometimes that it sort of works like email. So if you're texting with a patient and you archive the message, because that's really what you want to do. You want to archive messages when you're done with them. The second that person messages you back, the entire thread comes back. So you're never losing any information. It just continues on. So the goal is to leave your inboxes pretty cleared so that whatever's left in the inbox is something that you still need to touch on, you need to do something with. So I don't always recommend leaving things in your inbox, but if you're having trouble and maybe if your EHR doesn't support you how you need it to, you could use Spruce to kind of help you organize things through, in this situation, an onboarding process. So this particular practice, super high volume, was having trouble tracking where people were in the onboarding process. Appointments were approaching their due date. There weren't, charts weren't completed, insurance wasn't verified. This was resulting in late canceled appointments. And now that's an hour or 90 minutes even out of a provider's time that they're not getting paid for. It's just kind of this blank now in your schedule. And so a part of what I do with VMR services, I want to avoid that for my providers. So I got with this provider and we decided that because of the way her onboarding process was set up, she needed help to kind of check them off at certain stages and move them into the next stage. So we set up inbox filters for her to track where the patient was in that process. It created kind of a more hands-on and visual method of ensuring the tasks were completed when they needed to be completed. With this method, the patient conversation is kind of tracked between these multiple folders that coordinate with the stages of this particular practice's onboarding process. So the image is still focusing on this image here is still focusing on filters within the inbox, but gets a little bit more involved. Here you can see the labels, the filters labeled pending pending insurance, tracking paperwork, and appointments. They're kind of towards the bottom of the image. This allows for the practice to kind of route or assign messages into the folder pending insurance, which is the first step in her onboarding process. Once the insurance is verified, they're able to move that whole patient thread down into the tracking paperwork folder, and so forth and so on. This may not completely match your onboarding process, but it certainly helps them keep their high volume practice a bit more organized. So they know, whoever's left in the appointments folder, they haven't been able to get in contact with them. And so they know to keep trying. They know that by the time the thread moves into the appointments folder, that patient's chart is going to be completed and the patient is ready to book. Like I said, this may not fit your practice, but this is just an example of something that you can use Spruce to keep you organized in other aspects. While you're looking at this image, I would also like to talk about the other folders that you see here, or the filters that you see above pending insurance. Here, there have been filters created that correspond with this practice's phone tree. So as calls come through and selections are made on the phone tree, the system, Spruce itself, will automatically route that call into a filter that corresponds with the selection made. So if you have press 1 for appointments, 2 for billing, if they press 1 for appointments and leave a voicemail there, it floods into an appointments filter. And you can imagine that this kind of helps you triage your day. For example, if a patient calls in about, in this case, maybe a billing and credentialing question, and they leave a voicemail on that line, like I said, it's automatically going to go into that corresponding folder. It allows you to determine what folder you think is most important to attend to first, and then kind of prioritize what to take care of next. Did you have something to say, Jess?
Yeah. So, and that's for voicemails that come in. The other thing that I think we touched on earlier is patients will call a bunch of people to try and, call a bunch of doctors listed in their, insurance or whatever. So the other thing that you can set up in Spruce is if you get, and this came up as a Q&A, if you have a missed call or even a voicemail left and you're super busy, you can have an auto text back that says, thanks for calling our practice. Sorry we missed you. How can we help you? So picture if you're that patient, then you're immediately like, oh, this is cool. This is super easy. I can, message them. And you can also, cater the message with what it says, what time of day. So then it doesn't feel disruptive. If it's at night, you just set that expectation with them immediately.
Yeah, you can even go a step further, guys, and assign certain team members to each of these filters. So they'll get directly notified when something drops into that folder. So they're not being notified about things that aren't their responsibility and can focus on the things that are. Again, like I said before, we're really just scratching the surface of Spruce's abilities. It certainly is the most customizable system we've worked with and have done so many different things to help cater to a practice's specific needs. Like Jess said earlier, we're not employed by Spruce. We simply just firmly believe in their platform and what it's capable of doing, to make our clients' lives simpler and just a tad bit more secure. So if you'd like to talk about troubleshooting ways we can help you streamline, please just don't hesitate to reach out to us. And I think I'm going to hand this back over to Jess so that we can try to get some of these Q&As. I'm sorry for taking up your time.
Oh my God, no. Thank you, Beverly. You guys are awesome. So there was a lot of questions. I answered some of them, just typed them out. If you want to learn more about Spruce and Silverleaf, we're going to link to them, and we have a help center as well. But so some of the questions, Beverly, these ones came in earlier when you were talking about starting a business. So someone was talking about, I'm starting a cash-based practice serving patients in my neighborhood, and I'm planning to provide care out of my home. I'm an internist. I understand the concern around boundaries. Like you mentioned, don't use your home address, and Beverly, you're muted. Are there issues that I should think about in particular when starting kind of a homebound business besides, not registering your address?
Well, I mean, there's a lot of things to make sure, that the big one is making sure that you're able to stay HIPAA compliant while you're at the home, right? You need your own office. You need to be able to lock the door on your office. People should not be able, in the rest of your home should not be able to hear your conversation with patients. That's huge HIPAA violations there. So you have to make sure that you take all that into consideration. The other thing is you need to have a shredder, be able to shred your papers immediately, because
all important
we all
detail.
Yeah. We're not completely, all HIPAA compliant, even we're on telehealth. You still gonna have papers you take little notes on or whatever. You have to make sure that you're able to shred that and discard it. The biggest thing is interruptions and stuff too, and prioritizing your time. Also, I find it, and Megan could probably back me up on this, is when you work from home, it's difficult to shut things down and walk away and say, okay, my day is done. When you leave a physical office, then your day is done. Now you go home. When you're having your practice in your home, it's harder to do that. But you're like, oh, just one more email. Oh, just one more thing. And then before you know it, you've ran an hour and a half over your business hours. So make sure that you know when to stop everything. So as long as you're staying HIPAA compliant, and knowing when to walk away, I think those are two big things that you should be thinking about. They said they were cash pay. I think the question went away, and I was trying to review the question there.
I think that's a good start because we have some more in lieu of time. I just want to keep moving. Do you guys have policy procedure templates, or do you have any suggestions if someone reaches out to you?
Yes, so we do have a lot, like if you use Intake Q, that's one of the EHRs that we recommend. We have a lot of policies and procedures in there, but a lot of those can be taken as a PDF too, and you can take that information, customize it to, pull it into Adobe or whatever PDF filler, and use that content there to modify for your practice if you're not using Intake Q, where we can just send it over to you, easily. So
Great. So a couple other questions came in about EHRs and Intake Q and Spruce and integrations. And so since enough questions came in, I do want to address it. So Spruce is currently only integrated with one EHR deeply, and that's called Elation Health. And we do demographic syncing as well as message sync. Spruce has just publicly launched an API. And so you can reach out to your own EHR and say, hey, they have an API, you guys should connect. Integrating with EHRs is not a simple task. It takes time and it's complicated. And so now that we have this API, we are reaching out to all these different EHRs and saying, we should connect. Your customers want it. The more you ask them for connecting to Spruce, the more they're going to listen and want to do it. So it's a multifaceted kind of solution. So please reach out to your EHRs and ask them to integrate with Spruce. Feel free to email me at sales@sprucehealth.com if you have additional questions there. If you are not integrated with Spruce, it's okay. Your EHR, you can copy and paste anything from Spruce. We multi-select or one select each message, whatever you want, to your EHR, and it reformats it to be formatted in a more legible form. Also, don't forget, Spruce is a medical documentation source, and it's organized all by the patient's number or their name. So it's super easy to just go back and check stuff. So it's unlike when you're using your cell phone or email where you're like, this shouldn't stay here. It can stay in Spruce. So I'm actually seeing a trend of less is going into the EHR that happens in Spruce because there's a lot of just niceties around texting and call logs and So that's the one thing. Intake Q is an EHR. Beverly and Megan often recommend it. We don't have an integration. We are in discussions with them, and I have no idea if it's going to happen or when. It's unfortunately it's too hard to say at this, and I don't want to overpromise because I really want to make sure when we launch it, it's real. But definitely keep your Spruce emails, view them because we will announce things there, and also keep asking your EHR to integrate with us because that's very helpful on our side. All right.
Jessica, so with these questions, I know there's been several answered, but I was looking through those and there's probably some stuff I could add into those. Can we get a list of these questions that have been asked? And then I'm happy to answer these and we can send that out with the webinar. Because I know that we're getting really close to the end of our time and people ask some stuff that, could get a little more detailed than just answering one simple question. I want everybody to have the opportunity to get all of their answers that they might want. We can
create a FAQ from this
and then I will respond to them when we can send them all out with the webinar. That would be great.
Yeah, so throw your questions in now and we'll make sure to address them as a team and get it and send that out with the email of the recording of this as well. And so, Kara, why don't we just hop to the next slide to kind of give all the contact information so people can also just start going to our websites and learning more. So you obviously have sprucehealth.com. Someone also asked about what prices were for Spruce, and we are running the webinar, so I will tell you prices start at $24 per teammate per month. You can find them on our website under plans. We also have an upgraded plan that includes like the phone trees. That's $49 per teammate per month, all inclusive pricing, no additional costs. And then our blog.sprucehealth.com is an excellent resource if you want to see a provider like you. We have them on there. So we have every type of practice specialty. So, and then Silverleaf PMS, like go put that into your URL on your other tab or whatnot right now and check them out. And then Beverly or Megan, I'll let you take away with other links on what they mean here or care.
Yeah, sure. So little secret, if you go through us to help you set up your Spruce, little plug here for Silverleaf, you get a discount on your monthly Spruce too. Just throwing that out there. Little bit of a discount, not huge.
Shameless.
Yeah, shameless plug.
Oh, no, it's great.
Yeah,
Shameless
so-
plug.
But and if you want that code too, I can provide that to you guys. It's on my our Facebook group. If you're on there, you can email me, I'll send it to you. But you have to go through us to set up, your phone trees, all that stuff, but that's neither here nor there. The classes. So there's a class that I did that walks you through and talks you through a lot of things to think about and consider when you're starting your private practice. It's like an hour, I think it's like an hour and 20 minutes long, but that is a whole, just me talking to you for an hour on starting up your practice. The webinar is something that we actually have another partner, Brittany, who is over the billing and credentialing. She's also the third partner here, but she manages over that area. The three of us, her, Megan, and I, did this webinar. It was live, talking to folks, answering questions about all three of our areas and things that you need to think about when you're starting up. So that's very useful information as well. The checklist just kind of keeps you on track in the very beginning stages, like, establishing business credit and, all these little parts and pieces to get an office set up and things like that. So it's very detailed on that very first part of setting up your practice. And then the YouTube video is basically the consultation video that tells you all about our services. There are little tips in there and stuff too, but you can watch that on your own time and just kind of get an idea of all the services that we offer. Then we also offer the consultations. So you can schedule, most of our consultations are free, except if you want a one-on-one with me to pick my brain, ask me a bunch of business questions, those are chargeable just because it is a lot of business information that you will get. But if you want to talk to Megan about Spruce and get some ideas from her, it's free. You can talk to her credentialing department, free, marketing, all that kind of stuff. So you can definitely schedule any credential or any kind of consultation you might want. And then we do have an online Facebook group. It's primarily for, psychiatric mental health nurse practitioners, but we have all disciplines in there. Honestly, we have lactation consultants, we have therapists and stuff like that in there as well. So there's a lot of information that is helpful just starting up a practice altogether. And then you can also email us at info@silverleafpms.com. And I'm happy to answer any questions there. And Megan, if anything's Megan's related, I can forward on to her as well. So that's
amazing. My gosh, we covered a lot of territory today. You guys did great. And just so the folks on the call don't panic, I am going to be sending you all of these links in the follow-up email. So you're not going to miss out on any of this. We'll also get the answers to these questions over to you. They may come under separate cover, but you're going to get everything and more from this webinar. With that, we are almost at the top of the hour. I want to thank this entire panel for this incredibly informative discussion today. I know that I learned a lot of good refresher stuff in there too. And I'm guessing that by the number of folks that stuck with us the whole way, people were really engaged. So thank you, Beverly. Thank you, Megan. Thank you, Jess. Great.
Thank you, everyone.
Thank you.
Thank you. And I hope everybody joins us next month.
Take care, guys.